أنا باسم الشافي أرقيك من كل سقام يؤذيك، بيميني أمسح ما تشكو وبعمر الباقي أفديك، وأتمتم دمعا ودعاء يرعاك الله ويشفيك، وأتمتم دمعا ودعاء يرعاك الله ويشفيك. لا بأس.
بسم الله الرحمن الرحيم. إن الحمد لله نحمده ونشكره ونستغفره ونعوذ بالله من شرور أنفسنا وسيئات أعمالنا. Viewers at home, you are once again welcome to today's episode of the Earth Talk. This is Ummatan Wasatan TV, leading humanity to salvation. In our last episode on Health Talk, we discussed issues that brought us on tuberculosis, and we explored the causes, the treatments, and what have you. So if you have been following this channel, you have gained a lot of things from what we discussed last. But there's something I want to chip in before we commence with today's program. In the last episode, my guest mentioned that the reported cases of tuberculosis in Nigeria is 700 as against 7,000 that she wanted to mention. So I want you to note that at least 7,000 is the data known presently. So 7,000 as against 700. Please note that. We are sorry for that slip of tongue. Today's program, inshallah, we'll be talking on different health issues on our health talk. And today's program will be talking on common eye problems. So I have my name is, as you know, Dr. Lukman Mohib Shitu. I'll be the anchor of this program, and I have in the studio with me Dr. Ibrahim Yusuf. Please, Dr. Ibrahim, please, I want you to say Assalamu alaikum to the audience at home.
Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum assalam.
Thank you very much for having me.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you, Dr. Ibrahim. Dr. Ibrahim is a consultant, ophthalmologist, at the University of Ilorin Teaching Hospital. He will be talking on problems that are related to common eye problems. In this program, as we move on, we'll give opportunity to our audience to place adverts, to advertise their products and themselves in areas that are very important, especially that are related to health matters. So some of the information on the screen, you can have our numbers there to contact our agents all over the nation. So if you want your product and you want your product to be known all over the world, this program is televised all over the world on YouTube. So you very soon will give opportunity to our audience to do all those. Inshallah, Dr. Yusuf, for today's program, problems that are related to eye. Please, what are the common eye problems, Dr. Yusuf?
Thank you very much. Alhamdulillah. Well, this is a very fantastic question. We have a lot of common eye problems. Before now, we used to talk more of tropical diseases that are affecting a lot of our population that are really, really endemic in Nigeria. We used to talk about onchocerciasis on the eye. We used to talk about vitamin A deficiency and its effect on the eye. We used to talk about trachoma and all those things. But lately, a lot of things have changed. We're beginning to see more new things, maybe because of the westernization and the urbanization. But if I'm going to categorically put it, I would say, well, the common eye problems we have generally, one is talk about cataract. Cataract is a major concern to us. Talk about glaucoma, talk about refractive errors, talk about corneal issues. In fact, maybe at the end of, I don't know how long it's going to take us, maybe we can have a time to talk about traditional eye harmful practices. So these are just generally speaking. Of course, maybe because of as I said, about westernization and urbanization, talking about our exposure to strain and low lights these days, we're having a lot of issues on what computer-related eye issues, digital eye strains, also known as computer vision syndrome. We're having issues about issues with low lights as it relates to degenerations of the macula and hearing. So, generally speaking, that's just the common eye problems that we have.
Thank you, Doctor. Some of these eye problems you mentioned, there are some of them that interest me most, and I don't want to go there first. I want us to focus on at least one, because almost all of them interest me, especially those ones that have to do with this gadget of it that we are used to these days. Some of those ones that affect, that as a result of our long exposure to those gadgets. But before we go there, our viewers are too, especially our papas and mamas, and even those youngsters that are battling with one problem or the other. Can you please narrow it down and talk more on possibly glaucoma?
Glaucoma. Some people call it the silent. Is it the silent thief of vision? Some other people call it the hypertension of the eye. It's a major public health issue. It's, in fact, I can say now that I think even the prevalence of glaucoma these days has increased significantly. When we talk about glaucoma is a disease of the optic nerve. It's a disease of the ganglionic cells, because let me just put it down so that the viewers at home will have a better understanding. Now, before we will be able to see, light must get into our eyes, and when light gets into our eye, there's a lot of things that happen at the back of our eye, and then what we've seen must get to the brain, and then so we have a connection between the eye and the brain. And that's the optic nerve. That's the nerve that connects the eye to the brain. So what we have in glaucoma a lot of times is, for whatever reason, the pressure within the eye begins to build up. The normal eye pressure is between 10 and 21. And then you have water, let me say water, so that you can have a good understanding, being produced within the eye to maintain the high rigidity. The high, how do I put it now? The high rigidity. So now there's a turnover of the fluid within the eye. But for whatever reason, you will notice that over time, this pressure, the water within the eye begins to accumulate because there's an issue with the drainage. And then the pressure, of course, when you talk about increase in volume, of course, definitely there's going to be some level of increase in pressure. So this increasing pressure begins to damage the optic nerve. Gradually over years. You see some people in the hospital, their pressure in the eye is as high as 70, as high as 60.
What's supposed to be around 21?
And so of course over years, and that's why it's called a silent
hypertension.
No, I said silent thief of vision. So it's usually symptomless, especially the one we have around us here. Usually you have no
pain. You don't even notice any symptoms.
You don't even know anything is happening to you. Your pressure beats up gradually over the years, and then before you know, the optic nerve begins to get damaged over time. And then of course, it affects the peripheral vision first. But there's no way you'll be able to know that you have an issue with the peripheral vision except it's very advanced. So by the time it's affecting the central vision, that eye is almost gone. And so that's why it's a very, in fact, in fact, people are now also relating it to the springtime that we have. That because, I don't know, maybe because of the westernization, I don't know what's really going on these days, the prevalence has increased. In fact, you can hardly, maybe let me say, like, in every 10 patients you see, you have like 34 patients that you are suspecting glaucoma. And it's a major issue. And I pray that we don't have an epidemic of glaucoma in the future.
Thank you so much, Doctor. So, what is the burden of this glaucoma on the
the burden of glaucoma is, if you look at it on the ward, you look at it locally, you look at it on the patient themselves, you look at it on the relatives, the guardians. Because the ultimate thing about glaucoma, why we are so much scared about glaucoma, is because of the blindness that is resulting. And then the blindness is irreversible. And that is why everybody should be worried.
It's irreversible.
It's irreversible. Any damage you have from glaucoma is irreversible. And that is why everything should focus towards us picking it on time. Pick it on time and you lower the pressure. You pick it when it's advanced. I mean, a lot of times the patients will end up going blind, and that is what we don't want. So when you look at the burden of blindness from glaucoma is significant, because it's irreversible. You go for an outreach in a place this year, you see the same patients. You go in the next 5 years, they'll still come out. Because maybe because the number is increasing. Before you know when you talk about cataract, you go to a community, you do a large screening, you can have patients, maybe like 50 patients who have cataract, and then you will just do the surgeries, and then the number of patients that you've operated have left that
problem.
Yes, you have reduced that burden. But glaucoma is different. Once they go blind, they will keep coming to you. It's a major issue, and we should all be aware of the importance of glaucoma. We should all be aware of the burden of glaucoma, and then we should also know that you can't just be living your life without checking your eyes. Yes, thank you.
Well, I am very. You see, the way there's a question that is begging for an answer, and that is because you said it is almost asymptomatic.
Yes.
What are the common symptoms of this glaucoma? Do you have any symptoms?
Well, you see, we have different types of glaucoma. Okay. We have the primary, we have the secondary, we have the open angle, we have the closed angle. For a lot of patients who have the closed angle, they usually have pains.
Okay.
They usually have pains. But we don't usually have. Most of our patients are open angle. So pressure builds up. In the closed angle, the pressure builds up over a very short period of time. So the pain is, patients just comes to you that, doctor, I'm having pains. The eye is red. They are very uncomfortable. So that will bring them to the hospital.
Okay.
In my opinion, I think that's even better. But for patients who have the open angle, the pressure builds up gradually. Maybe from 18, 19, 20, 22, 24. So there is no pain. The eye adjusts.
Adjusted itself.
Yes, to the high pressure. So they don't have pains. They don't have.
Doctor, you are mentioning the treatment or some of these things. Is it possible that we just go to the pharmaceutical shop and get some of these drugs and use on our, or there are specific places to go for the treatment?
Okay, so let me put it this way. If we talk about classification of health system, we talk about the primary health, the secondary, and the tertiary. You can, it's the secondary health care and then the tertiary that can manage glaucoma for you. So when I say secondary health care, I mean the general hospitals, the specialist hospitals, the teaching hospitals. These are places where you can have access to. If you look at Kwara State now, we have the self-service clinic where they have a robust eye practice. You have the general hospital at Surulere roundabout where you can also access eye care. Of course, the teaching hospital is there. and then a few of other private hospitals who have competent hands that can help you manage glaucoma.
So in most states, in Nigeria, for instance, teaching hospital, specialist hospital, general hospitals are the most encouraged place that we should tell our people to visit, not just any local areas. Yeah, thank you, doctor. There's something that is that there are two things that I want you to please. How costly? What is the cost effective of this treatment of the eye problem?
Well, managing glaucoma is expensive. It's a lifelong thing. If you're going to be on medications, you're going to be on medications for life. You have to be on medications for life. The same way you use the antihypertensive, your oral hypoglycemic medications for diabetes, that's the way you keep using your high medications for life to lower the intraocular pressure. Because once you stop your medications, pressure builds up, the damage on the optic nerve continues. And that's a major thing. Now, if you look at the Nigerian system with the issue with our currency, with the issue with dollar, because you don't have a lot of these medications produced in Nigeria. A lot of these medications are determined by the rise and fall of dollar. So it's a problem now for a lot of our patients. A medication can be as high as 17,000, 18,000, some 10,000, depending on the price. Of course, the more potent the medication, the more expensive. Of course, if you now look at our minimum wage, look at the living standard of people, look at our poverty index, how many of our patients
can afford
to continue to be on this medical? That is why you have issues with poor compliance. Poor compliance. They will come with you and then you counsel them very well, and then okay, don't worry, I will make sure I buy this medication. My kids will send money to me. I mean, look at this. When we had COVID, we had a lot of issues with our patients. Even the relatives, the kids that were sending money to their parents had issues with their businesses. Salaries were not coming in. So for months, patients were not on medications. So that's why sometimes we counsel more for surgery. You do surgery at a time, and then hopefully everything goes out well. Of course, your pressures will be controlled over a very long time. So for medications can be used. It can be also managed surgically, where trabeculectomies, shunt procedures, and all of it can be done. And of course, the lasers. They will have lasers that can also be done to also reduce the intraocular pressure.
You said lasers?
Yes.
Can you come down to our level?
Okay, so what it does is that instead of opening up the eye and doing a lot of things that we do in the theater, lasers, what they do is that they can help increase the size of the hole through which the aqueous, the fluid within the eye, percolates through. So that at the end of the day, it will reduce the intraocular pressure. A lot of pathogenesis, the lot of ways by which these lasers, by which they work. But the long and short of the whole thing is that they reduce the pressure within the eye. They can improve outflow. Some lasers will reduce the amount of secretion of the fluid.
Doctors, we are talking on the symptoms.
Okay.
Do we really what are the causes of the glaucoma?
Well, as I said, that if you classify glaucoma into primary and secondary, the primary ones are the ones that really does not have any cause. It just happens like that. The secondary, you can pinpoint a cause. There's a reason why the pressures are going up. Now, for the primaries, which are the commonest ones that we have around, we can only talk about the risk factors. Increasing age is a major risk factor. Increasing age. By the time you are over 40, it's just the same way you have an increasing prevalence of hypertension, of diabetes after the age of 40. That's the same way that the prevalence of glaucoma also increases with age. Now, some form of refractive errors, if you have some patients who have hypermetropia, they may have the angle closure time. Patients who have myopia, who are myopic, may have the open angle closure and the open angle time. Family history is a major concern. Family history is a major concern. If you have a parent, a mother, a father with glaucoma, the kids must also they must also keep an eye on they must also keep checking their eyes because they're also at risk. And of course, if you have a sibling with glaucoma, you should not just fold your hands, you should always see your doctors to be sure that you don't have an issue. Of course, if you're going to talk about the secondary causes of secondary glaucomas, trauma is a major thing. You have an eye injury from any reason, you are always at risk of glaucoma, and of course other things.
Okay. Then please, doctor, having known some of the symptoms and causes, sometimes you mentioned, you said like the family, if you have the history of the family of possibly maybe a father or mother or even siblings having glaucoma, how does it related to the cause? You are saying the pressure on the eye, on the optic nerves or something, then you were mentioning that sometimes it might be as a result of injury. How does it related to related to the family?
Well, of course, the secondary types of glaucoma, there's a cause for it in the individual.
Okay.
Those ones will not be related to the family. Those ones do not have any familial tendencies. But for the primary types, there is a risk factor. Studies have shown that if you have a patient, the risk of glaucoma is higher in an individual who has a father or a mother or a siblings with glaucoma. Of course, over time, people have realized that. And that's why usually when you come to the hospital and you have glaucoma, we'll ask you, do you have a family history? And usually when we have, and then it's not usually about glaucoma sometimes, it's about glaucoma blindness. Because if you have a father who is blind from glaucoma, you're not just at risk of glaucoma, you're also at risk of glaucoma blindness. And that's something to check out.
No, thank you, doctor. You see, those viewers who want to know where can they get the best treatment, especially in Nigeria and primarily in Kwara State.
Okay, so the thing about glaucoma is how is it called now? It's to pick it on time, early diagnosis and treatment. Of course, I said that it results in an irreversible visual loss. So once you have a damage to the optic nerve, the ganglionic cells are gone. The doctor, irrespective of his professionality and his equipment and everything, he won't be able to reverse the vision. So the best thing is to pick these patients on time, and then you can't pick these patients on time except these patients willingly. We should as individuals, as citizens of this country, cultivate the habit of, okay, I want to check my eyes. Okay, I mean, people, in fact, I'm also very happy these days that when people want to, for kids that want to gain admission into universities, into secondary schools, the schools are beginning to ask them for visual fitness. Go to the hospital and they let them talk to how is your vision, are you seeing, I hope you don't have all those things will have to be documented. By the time you're at age 40, you must do one way or the other. The way you're checking the blood sugar, you're looking at your blood pressure, you must also see an ophthalmologist to look at your eyes, and then so that they'll be able to pick it on time. Now when they pick it on time, there are different ways of managing it. The first, of course, there's going to be a lot of investigations. I spoke about the peripheral field that will be affected in the initial phase. So, of course, the initial thing is to do some investigations like the visual field examination, the test to check the intraocular pressure.
Please, visual field.
Yes.
Doctor, you said visual field. Are viewers at home? Are you sure they will know all these stuff?
Oh, sorry. Visual field is just, how do I put it now? It's what you can see at a point in time.
Okay.
You close one eye and then you look at things ahead of you. Those things you can see at a point in time, that is the field.
Okay.
So I said glaucoma will usually affect the periphery, and then it will keep going towards the center. And then by the time it gets to the center, that's when the patient will start saying, "Doctor, I'm not seeing." And of course, at that time, the eye is almost gone. So once they get to the hospital, they're going to do some investigations, and once they confirm there's glaucoma, glaucoma, because we also have to be careful. It's not every eye that we see that looks like glaucoma that is glaucoma. And that's why the patient must be fully investigated to be sure that, okay, truly there's glaucoma. So once there's glaucoma, it can be addressed using medications. There are some medications that can be used to lower the intraocular pressure. The only thing we can do as doctors is to lower the pressure, because we know that the high pressure is what has been resulting in the damage. So our belief and our hope is that once we lower the intraocular pressure, the pressure within the eye, using medications, using surgeries, using
thank you, doctor, for this wonderful information you are giving us. Please, I want you to please help us look at how can we prevent this. Those people that may not have glaucoma for now, how can we prevent it? And because this thing, if it's preventable, I think it will be better not having it at all than to be not managing it when it happens.
Yes, thank you very much for this question. The main thing about glaucoma is to sometimes, let me put it this way, that there's you may not really be able to prevent glaucoma from happening, especially when you have the risk factors. The main thing about glaucoma is for you to be able to, for doctors to be able to pick it on time and then manage it so that it won't lead to an eventual blindness. So what we should do as individuals is to just check our eyes. We should cultivate the habit of checking our eyes. Go to an ophthalmologist today and check our eyes. Now you see, you need to understand that there are a lot of people who are walking the streets of this country today who are not even seeing in one eye. And they will not know they are not seeing in one eye. If you don't close one eye and see to be sure that, oh, is this other eye working, you will not know that this other eye is not seeing. So, but the ultimate thing is that we should pay more attention to our eyes. The Yorubas will say, Oju Lobara. Without the eye, there are a lot of things you won't be able to do as an individual. So we should pay more attention to it. Check your eyes once in a year minimum, especially if you are over the age of 40. Check your eyes once in a year. Check your intraocular pressure. Sometimes the pressure is building up, but we're not seeing the damage on the optic nerve yet. So you must check your pressures. Check. Let the doctor just help you to look at it just to be sure. And just ask the doctor, I hope I don't have glaucoma yet. And so that you can have something as a baseline to follow you up subsequently. So they may ask you to run some tests just to serve as a baseline. So when you come next year for them to check, they will have something to relate to compare to be able to say, oh, you're still doing very well. Oh, we need to do this and this and this for you.
Thank you so much, doctor. My next question would be, in Nigeria and most parts of the world, when people have one complaint or the other in their eye, especially even this glaucoma, you not necessarily know what it's all about. You'll be directed by your siblings, by people around you to say, oh, use this, add this. What are the traditional eye harmful practices in Nigeria especially?
That's a very good question. And it's something to really talk on, because it's a major cause of visual morbidity in our environment. We have a lot of, Nigerians, we have a lot of cultures. There's some things that we inherited from our forefathers that some of our parents today, they still believe that those things are very right. Now some people will have, there's Apollo in Nigeria, there's an epidemic of Apollo, and then they say, okay, go and put battery water, go and put cassava extract, go and put sugar, salt water, in fact breast milk. In fact, there's one of our patients recently that came, was having redness of the eye, and instead of him to come to the hospital, requested he went ahead to use his urine water, his urine. He instilled urine into his eyes. This is a person that was poorly managed for gonorrhea, So he used gonorrhea, instilled gonorrhea into his eyes, and he almost lost his vision. In fact, and then we've documented some of our patients who were coming blind from installation of urine into the eye. So there are a lot of things people are doing. In fact, let me say, like about 2 weeks ago, I was in Shaki to see some of our patients. I saw an 8-year-old child that had discharge in the eye, and then the mother was instilling breast milk. The child came, the whole eye was almost gone. The whole cornea is messed up, a lot of prevalent stromal absence here and there. Of course, by the time you're even done treating the child, it's not likely that child is going to be able to see with that eye again. So there are some things we shouldn't try to do. These are things we should all be conversant with the fact that the eye is so important to us. You can't just with your own, or maybe you've done it for somebody, or it has worked for somebody, but you need to go to an hospital when you have an issue with the eye. You need to see an eye doctor to be sure that the right thing is being done to you. Don't instill cassava extracts. People, farmers, they have some extracts. Okay, this leaf and this leaf, mix it together, and then you can use the juice, instill 2 drops in the morning, in the evening, and then they come back to us. The eye is almost gone. We don't like seeing cases like that, and that is why this is a very good medium to address this issue and then to counsel Nigerians that when you have an issue with the eye, go to an eye doctor. Don't instill urine water, sugar water, cassava. There are all sorts of things here and there. People, in fact, how can you instill acid, battery acid into your eye, for God's sake? What do you think is going to come out from a battery acid? So I want to implore Nigerians to please be very careful and to please go to the hospital when you have an issue with the eye. And of course, you also have issues with patients just going to the pharmacy shops to just get an eye drop. I have a redness of the eye, and they'll just give you anything. There's some medications you can't use for a very long time. You use steroids for a very long time, it leads to glaucoma. It leads to glaucoma. And then we'll keep coming to the hospital, we'll keep battling with a lot of these things. Some patients we won't be able to help them because by the time they are come to the hospital, it's already late. And we don't like seeing things like that.
So even using some of these drugs that are conventional drugs, some of them can have some side effects. If it's not prescribed by the doctor.
Yes, you can't just use any medications. In fact, one of our patients, we gave medication for the right eye. We gave a cycloplegic medication. I mean, I don't want to go into the details of the medication. Patient went ahead to instill into the other eye. These are medications that when you instill into the other eye, you won't be able to read for 2 weeks. You can't just do anything
on your own.
You can't just. In fact, some patients after surgery, they are some medications, and then they have their grandkids who has redness of the eye. They're like, okay, come, I have some medications in my bag, and then this grandmother, the grandfather, will instill these medications into the kids, into the eye. So these are not the best for us. We need to understand that there are different types of medications with the different forms of actions, and this is not just, you can't just keep using anything into your eye. It has to be well prescribed by the ophthalmologist.
Thank you so much, doctors. Our viewers at home must have gained one thing or the other from our doctor discussing common eye problems, and you can see, because we don't want to make it in a way that it is just going to be academic, having a lot of things to discuss without narrowing it down to a sizable size that our viewers at home will gain from it. Today we obviously narrow it down to glaucoma, and this, you must have seen some of the symptoms, the causes, the treatment, and what have you, and some of the harmful practices that eye practices we have in Nigeria that we need to guide against. So if you're having problem in your eyes, you don't go ahead and use any concoction or take acid or what have you, as mentioned by doctor. Doctor, please, before we go, some people say that hitting students or individuals on the head. Does it have anything to do with the glaucoma or maybe other eye problem?
Well, we don't advocate. We're not saying we shouldn't discipline your child. We're not saying you shouldn't, as teachers, as madrasa teachers, you shouldn't discipline your students when they do wrongs. But what we are saying is that don't beat them on the head. Don't beat them on the head. In fact, left hands, we prefer that you beat them from the waist downward. We prefer that. Don't beat them on the head. Now, because the issue is that we've had cases of irreversible visual loss from injury, just from beating. You see the alpha or the school teacher who beats the child, hits the child on the eye, and then before you know, the eye is gone. This eye is so fragile. Any form of injury, a lot of times, in fact, sometimes you look at the eye and you're like, this patient should be able to see, and then maybe we as doctors have managed the ones on the surface, but you already have some other deep damage that you won't be able to do anything to us. And then we talk to people, don't beat your child when you're very angry. Don't beat your child when you're very angry. Don't beat any child when you're very angry. And don't beat them waist up. Beat them waist up, beat them on the legs. I mean, nothing will happen. Don't beat them, because in fact, sometimes you want to beat them, you end up injuring yourself. You have a mother recently who was trying to beat the child, and then the rubber flew backward and then lacerated the cornea of the and in fact it was just a very bad scenario. These are not things we like to see, because after injury, even as doctors, we can't categorically tell you with all our efforts that we'll be able to bring this eye to the pre-morbid states. And these are not things anybody will be happy about. So please, let's be very careful. Don't let us beat our child on the head, and then please don't let us beat them when they're very angry.
Thank you so much, Doctor. We are very grateful for this presentation, and we hope our viewers at home, as I said, we get one thing or the other. The reason why I heard this is that when we were mentioning some of the harmful eye practices, we need to notice that some of these things that happens even in our daily activities, where teachers or even parents will beat their students, their wife, and this is resulting into a lot of high problems. So that was the reason why questions like this have to be, our viewers have to be enlightened. So inshallah, it is on this note that we want to draw the curtain for this program. As I said in the beginning, this segment of the program is on health talk, the different things related to our health matters are going to be discussed. We want to thank Dr. Ibrahim Yusuf for this wonderful presentation, and we hope that next time when you be invited, you will welcome our invitation. Sure. This is because there are a lot of things that we need to discuss as far as the health problem. You can see you mentioned different eye problems that are common around us, but just for the benefit of our viewers to at least gain maximally from our discussion, that's why we narrow it down to glaucoma. So others that are very common, inshallah, when next we come our way, we are going to discuss them in detail, especially those ones that are related to our youths, because when today you mentioned those ones that are related to a long exposure to YouTube, you mentioned some, to a screen and things like that. So those ones, inshallah, when you come our way next time, and when we come your way next time, those ones are going to be discussed. We thank Allah for this today's, and we pray to Allah to spare our life beyond next other one. So our program, inshallah, is going to be televised on Thursday. So every Thursday, please watch out for Health Talk on this TV. Assalamu alaikum wa rahmatullahi wa barakatuh.